Irritable Bowel Syndrome, IBS for short. You've probably heard the name, but what exactly is it? Let's break it down. Together, IBS is a really common condition that affects the large intestine, basically, your colon. It's not dangerous, but it can be a real pain in the, well, you know what I mean. Think stomach cramps, bloating, gas, and changes in how often or how urgently you need to go to the bathroom. So, how do you know if it's IBS? Doctors use something called the Rome-4 criteria. Here's what you need to know. If you've had belly pain at least 1 day a week for the last 3 months, and it started at least 6 months ago, plus, if your pain is linked to things like pooping, changes in how often you go, or even how your stool looks, you might fit the bill for IBS. Now, before you rush to Google every weird stomach feeling, here's a tip: start a log diary. Write down when you get pain, what your bowel movements are like, and how often you go. This helps your doctor match your symptoms to the Rome-4 criteria and rule out other conditions. Let's talk about what causes IBS. The truth? We're still figuring it out. Stress, gut bacteria changes, food sensitivities, they all play a part. But what really matters is how IBS affects your daily life. It can totally mess with your routine, your confidence, and even your mood. So what can you do about it? First up, diet. Many people find relief with a low FODMAP diet. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. That's a mouthful. In short, these are types of sugars and fibers that can be poorly absorbed in the small intestine, leading to fermentation and digestive discomfort in some individuals. But do this with a dietitian, not on your own. Avoid your personal trigger foods: caffeine, alcohol, fatty, or spicy meals. Small, frequent meals are easier on your gut, and of course, stay hydrated. Next, lifestyle changes. Regular exercise helps your gut move and can cut down on stress. Speaking of stress, techniques like mindfulness, yoga, or even therapy like CBT can work wonders. And don't underestimate sleep. A good night's rest can really help keep symptoms in check. Medications can help too, but only as needed and under a doctor's guidance. Antispasmodics calm cramps, laxatives or fiber for constipation, antidiarrheals for the other end of the spectrum. Sometimes antidepressants or even certain probiotics can make a difference. But here's the thing. I want you to listen to your body. If you ever notice blood in your stool, lose weight without trying, feel feverish or weak, or if your symptoms start after age 50, don't just chalk it up to IBS. See your doctor, especially if there's a family history of colon cancer, inflammatory bowel disease, or celiac disease. Living with IBS isn't easy, but with the right strategies, it's absolutely manageable. Keep track of your symptoms, work with your healthcare team, and don't be afraid to ask for help. Your gut and your whole self deserve it. Thanks for watching. Take care of your gut, and I'll see you next time.